Okay, now let's see which are the nerves related with the mandible. First, this is the mental foramen, right? From the mental foramen, which are the structure is coming out? It is a mental nerve and the vessels, right? From the mental foramen, mental nerve and the vessels, it is a coming out. It is ultimately a branch of the inferior alveolar nerve and the vessels. Now, in the mandibular foramen, there you can see the blue arrow. That is a mandibular foramen margin. So you can also see the mandibular foramen very well. So in the mandibular foramen, it is an inferior alveolar nerve and the vessels is entering. Yes. Okay. Now, here this is a mandibular foramen. So in the mandibular foramen, right, you can see this is the wire is going in the mandibular foramen, right? So in this mandibular foramen, inferior alveolar nerve and the vessels entering. Okay, below the mandibular foramen, you can see this is the groove. In this groove, mylohyoid nerve and the vessels is running. Mylohyoid nerve and the vessels. And this is the medial side of the neck. On the medial side of the neck of the mandible, it is related with the auriculotemporal nerve and superficial temporal artery. Now important is behind the third molar and above the mylohyoid line. Okay, behind the third, this is the mylohyoid line. So above the mylohyoid line, and here there is a third molar teeth. So it is a below the third molar teeth. Sorry, it is a below the third molar teeth, above the mylohyoid line. Over here, there is a lingual nerve is in direct contact with the mandible. Right? Lingual nerve is in the direct contact with the mandible. Okay, so this is the important nerves relation. Okay. Now, so again, if we revise which are the nerves, if we see, yes, there is a one more is left. This is the mesenteric notch. So from here, mesenteric nerve and the vessels is passed, which will supply the masseter muscle. Right? So which are the nerves? See, from the mental foramen, mental nerve and the vessels. In the mandibular foramen, inferior alveolar nerve and the vessels. Below it, there is a mylohyoid groove in which there is a mylohyoid nerve and the vessels. Then below the third molar teeth, above the mylohyoid line, in between over here, there is a lingual nerve in direct contact with the mandible. Okay. Then on the medial side of the neck of the mandible, it is the auriculotemporal nerve and the superficial temporal vessels. And in the mesenteric notch, it is a mesenteric nerve and the vessels. Right. So these are the important muscle attachment, ligament attachment we have seen, and the nerve we have seen. Now with the artery also. Okay. The important artery which is in the relation is, one is the important is facial artery. We have seen the facial artery, how it is entered in the face. See here there is a attachment of the masseter muscle, right? This is the attachment of the masseter muscle. Okay, attachment of the masseter muscle. Here there is an anterior-inferior angle of the masseter muscle. So facial arteries wind round below at the base of the mandible at anterior-inferior angle of the masseter and enter in the face. Same the facial vein also, it is a behind the facial artery. Okay. So this is about the important attachment and the relations of the mandible. See, this is the alveolar margin, right? So about the near the alveolar margin on the both outer and the inner surface, it is covered by the, it is a gum. That is a, okay, it is a gum of the mouth. Okay. Now some important difference in the adult mandible and the children and the old age. Now first is very prominent feature is about is a location of the mental foramen. Now in a children, this mental foramen is near the base. Near the base of the this mental foramen is near the base of the mandible, right? Because right now this area is not that much developed. The teeth is not developed. As there is a mandible is start more grow. Now the mental foramen in adult, it is exactly in the midline between the upper and the lower border. Okay. Then what happened in the old age? Teeth is shed off, though this alveolar margin it is absorbed, so this part of the bone is absorbed. So now the mental foramen is near the upper border of the body, body of the mandible, right? So in the children, the mental foramen is at near the lower border. In adult, it is in between the upper and the lower border, and in old age, it is near the upper border. In angle also, now this is the body and this is the ramus. There is an angle between the body and the ramus. Now in the children, this angle is about 140, and in adult, it is because of development, it is become the 110, and again in the old age, it is become 140. Okay, so this is about some changes occur in related with the age. Now, okay, there is a one common injury of the mandible. It is a fracture of the mandible. Most commonly, it is a fracture at this incisive fossa, which is followed by a triangle of mandible and the neck of the mandible. Okay, so this is about the mandible. We have seen the external feature, and also you have to remember all the muscle attachment, important muscle attachment, ligament attachment, nerve in the relation with the mandible. And which are the gland? Yes, which are the gland in the relation to the mandible? There is a 3 gland, right? Now this is the mylohyoid line. So below the mylohyoid line, here there is a submandibular fossa, submandibular gland. Above it is a sublingual fossa, it is a sublingual gland, and near this posterior border, there is a near the posterior border of mandible, it is a parotid gland. So 3 gland is also in the relation with the mandible. So 3 glands, submandibular, sublingual, and parotid muscles. It is the buccinator muscle. Important muscle is buccinator, muscle of mastication, that is a temporalis, masseter, medial pterygoid, lateral pterygoid, and also mylohyoid muscle. Then another muscle is depressor angulioris, depressor labile inferioris, mentalis, mental slip of the orbicularis oris. Ligaments attached, 3 first important is pterygomandibular raphe, stylomandibular ligament, and sphenomandibular ligament. Another is lateral ligament of temporomandibular joint, and periodontal ligament in the socket of the teeth. Nerve is in the relation is important is first lingual nerve, inferior alveolar nerve, mylohyoid nerve, mesenteric nerve, and mental nerve. Okay, so this all you have to remember about mandible. So this is all about the mandible.